Now let us begin with the next topic, which is the arterial pressure pulsations. Before starting, how about a little history of the pulse? Of all the traditional diagnostic methods, none is more legendary than the pulse diagnosis. And of the great masters of pulse diagnosis, none are so well known as the Egyptians. The Egyptians believed that the heart speaked out of every limb. What they might possibly be referring to is the pulse, which can be palpated in every limb. These masters of medicine, with nothing more than hearing the patient's chief complaint and taking his pulse, could arrive to a complete and accurate diagnosis of the person's condition. Some Greek, Chinese, or Muslim masters would rely solely on the pulse to diagnose and treat a large variety of illnesses. Some Muslim masters could tie a thin, delicate silk thread to the wrist of a female to diagnose her illness without touching her. Now let's study what is meant by an arterial pulse. As blood is ejected from the heart into the aorta, the walls of the aorta expand and then recoil. This wave of expansion and recoil is transmitted along the walls of aorta to the walls of peripheral arteries, where they can be palpated in the form of a pulse. It can be seen in this figure that when the heart contracts, it pumps the blood from its ventricle into the aorta. The aorta recoils and then pushes this blood in the form of a wave to its peripheral arteries. It can be seen within a vessel that the pressure which is exerted by the blood on the vessel wall is known as the blood pressure. The pressure which is exerted during ventricular contraction is known as systole or systolic blood pressure, and it is around 120 millimeter mercury, while the blood pressure which is exerted on the vessel wall during ventricular relaxation is known as diastolic pressure, and it is around 80 millimeter mercury in a normal human being. The same can be seen in this figure. As the ventricle contracts, it pushes a wave of blood into the peripheral arteries, which exerts a specific pressure on the vessel wall, and this is known as the systolic blood pressure. While the ventricle is relaxed, the pressure within the vessel wall is known as diastolic blood pressure. Now let us have a quick look at what happens during ventricular contraction. When the ventricle contracts, it pushes its blood through the open aortic valve into the aorta. The aorta and all the arteries expand and store pressure within their walls. Now, during ventricular relaxation, when the ventricle is no longer pumping blood into the aorta and the aortic valve is closed, these elastic arteries recoil, especially the aorta recoils and sends the blood forward towards the peripheral arteries even during the diastole. To study the wave of the pressure pulse, we must record the changes in the aortic pressure. The graph of the changes in aortic pressure looks something like this. You have already studied aortic pressure changes during the cardiac cycle. You must remember that the pressure in the aorta ranges from 80 millimeter mercury to a maximum of 120 millimeter mercury. During the rapid ejection phase of cardiac cycle, the ventricle pushes its blood into the aorta and the pressure in aorta suddenly rises to 120 millimeter mercury. When the slow ejection phase starts, this pressure slightly starts to fall. When the pressure reaches to 100, the aortic valve closes and the isovolumetric relaxation starts. This can be seen by this downward stroke of the aortic pressure curve. But when you look at this graph, you will see that instead of gradually reducing back to 80 millimeter mercury, there is seen a sharp incisor or dicrotic notch within the aortic pressure. What causes the incisor? The incisor is caused due to the sudden closure of aortic valve. When the aortic valve suddenly closes, the blood tries to rush back from the aorta into the ventricle. Since the valve is no longer open, the blood cannot move back into the ventricle and starts to accumulate in the aorta. This causes the wall of the aorta to stretch and the pressure in the aorta to increase, which can be seen by the rise in the dicrotic notch. After some time, the aorta recoils and pushes the blood towards the peripheral arteries. This results in the reduction of pressure in the aorta, and this can be seen by the diastolic decline in the aortic pressure. The blood pressure when the ventricle is pumping is known as the systolic blood pressure, and it is around 120 millimeter mercury. And the blood pressure when the ventricle is relaxed is known as diastolic blood pressure, and it is 80 millimeter mercury. The difference between systolic and diastolic blood pressure is known as pulse pressure. It is very important. You must know this definition and the value of the pulse pressure, and it is around 40 millimeter mercury. Pulse pressure is the difference between systolic and diastolic blood pressure, and it is calculated to be 40 millimeter mercury. So let us study what are the different factors which affect the systolic and diastolic blood pressure. So let us first study the factors affecting the systolic blood pressure. What is the systolic blood pressure? It is the pressure in the aorta when the ventricle is pumping, and in a normal person it is about 120 millimeter mercury. So now let's see what are the factors which affect systolic blood pressure. The first factor is stroke volume. Stroke volume is the amount of blood which is pumped from the ventricle into the aorta per beat. Greater the amount of blood pumped from the ventricle into the aorta, greater will be the pressure in the aorta. So, stroke volume is directly proportional to systolic blood pressure. Any condition which increases the stroke volume will increase the systolic blood pressure, and any condition which decreases the stroke volume will decrease the systolic blood pressure. The second factor which affects the systolic blood pressure is the compliance of arteries, especially the compliance of aorta. The compliance of aorta is inversely proportional to systolic blood pressure. What does this mean? If aorta is less compliant, or if it becomes less elastic, or if it becomes stiffened, now the blood which is pumped into the aorta is faced by a rigid and a stiff blood vessel, and the pressure within this vessel will rise. So, when the compliance of aorta decreases, systolic blood pressure increases. This can be seen in old patients in which there is atherosclerosis or stiffening of arteries, especially aorta. So now when the blood is pumped into the aorta no longer distends, it remains stiff, and the pressure inside aorta is larger than normal, and this is known as high systolic blood pressure resulting from atherosclerosis. So, the compliance of aorta is inversely proportional to systolic blood pressure. The third factor which determines the systolic blood pressure is the pattern of ejection of blood from the heart. The ejection of blood from the heart into the aorta can be affected by the state of the valves present between aorta and the ventricle or any other morbidity. So, the pattern of ejection of blood from the heart also plays an important role in determining the systolic blood pressure. We will study this further in detail. Now let us study the factors which affect the diastolic blood pressure. What is the diastolic blood pressure? It is the pressure within aorta when the ventricle is no longer pumping, and it only depends upon the resistance of the vessels which lie distal to aorta. So, the diastolic blood pressure depends upon peripheral resistance. It is directly proportional to the resistance of peripheral arterioles. The greater the resistance, the greater will be the diastolic blood pressure, because blood cannot move to the peripheral arteries due to greater resistance. It accumulates within the aorta during diastole and increases the diastolic blood pressure. Pulse pressure can also be calculated by dividing stroke volume by arterial compliance. This formula shows that pulse pressure is directly proportional to stroke volume and inversely proportional to arterial compliance. To better understand this concept, let's have a look at some examples. Here you can see a normal healthy aorta during systole and during diastole. In a healthy aorta during systole, when the blood is pumped into the aorta, the walls of the compliant aorta adjust this volume without great changes in its pressure. Then, during diastole, when the aortic valve is closed, this distended aorta recoils and pushes the blood towards peripheral arteries. Now let's see what happens in a diseased aorta or stiffened aorta, as can be seen in old patients with atherosclerosis. When ventricle pumps its blood into a stiff aorta, which no longer has the ability to distend, instead it remains stiff, you will see a sharp rise in the systolic pressure. Again, during the diastole, when the aortic valve is closed, since the stiffened aorta cannot recoil and push blood into the peripheral vessels, you will see a sharp decline in the diastolic blood pressure. Now let us study some abnormal pulse contours. First, let's have a look at a normal pulse. You know that a normal pulse looks something like this, the diastolic blood pressure is 80 millimeter mercury, the systolic blood pressure is 120 millimeter mercury, the pulse pressure, which means the difference between the diastolic and systolic, is around 40 millimeter mercury. There is a dicrotic notch present, and this is what a normal aortic pulse looks like. Now let's look at different abnormal pulses and see what abnormalities are to be seen in these conditions. First of all, let's study what happens in atherosclerosis. As I already told you that atherosclerosis is the condition in which the aorta loses its compliance and becomes stiff. As I told you in the previous slide that the compliance of aorta determines the systolic blood pressure. When the compliance of aorta decreases, the systolic blood pressure increases. Why? Because the blood is now being pumped into a non-compliant stiffened aorta and the pressure here rises. So, normally the pressure, which should have been 120 millimeter mercury, is now raised to 160 millimeter mercury in a stiffened atherosclerotic aorta. While there is not much change in the diastolic blood pressure, because I told you that the diastolic blood pressure only depends upon the peripheral resistance. Since the peripheral resistance is not much changed in the atherosclerosis, so you won't see much change in the diastolic blood pressure. So what is the condition here? The systolic blood pressure increases, the diastolic blood pressure remains the same, and the pulse pressure increases. I hope you understood. I can repeat it for you. In atherosclerosis, the aorta is stiffened. When the ventricle pumps blood into the stiffened aorta, the pressure in the aorta rises because aorta is no longer compliant. This raised blood pressure can be seen as an upstroke in the systolic blood pressure, which is around 160 millimeter mercury. The diastolic blood pressure remains the same, but the pulse pressure increases because pulse pressure is the difference between systolic and diastolic blood pressures. Now let's have a look at another condition. This is aortic stenosis. Now what is aortic stenosis? As you know that the valve present between left ventricle and the aorta is known as the aortic valve. When this valve becomes rigid or stiffened, this condition is known as aortic stenosis. As a result, the blood which is to be pumped from the ventricle into the aorta faces large resistance. So the amount of blood which is pumped from the ventricle into the aorta is reduced, which means the stroke volume is reduced. And as I previously told you that stroke volume is directly proportional to systolic blood pressure, so you can see in this graph that the systolic blood pressure is reduced as compared to the normal. Also, the normal peak of the systolic blood pressure is lost because there is no smooth flow of blood from the ventricle into the aorta. So, what are the findings we will see in aortic stenosis? There will be decreased systolic blood pressure because of decreased systolic volume. We will see no specific change in the diastolic blood pressure, but Since the systolic blood pressure has reduced, so the pulse pressure will also reduce. Let me repeat it again. Aortic stenosis means that the aortic valve becomes stiff. When the aortic valve becomes stiff, the blood which leaves ventricle and enters aorta during systole is reduced, which means the stroke volume is reduced. Since stroke volume is directly proportional to systolic blood pressure, so this reduced stroke volume will result in decreased systolic blood pressure, as is evident from the graph. This reduction in systolic blood pressure results in decreased pulse pressure. So let us study another abnormal condition which is known as patent ductus arteriosus. First of all, we must know what is ductus arteriosus. Ductus arteriosus is an embryonic structure which is present in an embryo during the intrauterine life. But as soon as the baby is born, this duct is closed off. But in abnormal conditions, this duct persists and remains open, and this abnormal condition is known as patent ductus arteriosus. Patent means open and ductus arteriosus is this structure. Let me show you what is patent ductus, what is ductus arteriosus and what is its function in the embryonic life. You can see this blood vessel which is connecting the aorta to the pulmonary artery. In an adult, this duct is closed off, but during embryonic life this duct is open and it plays a very important role. When the blood from the mother reaches the heart of the baby, it enters through the superior and inferior vena cava and is carried to the pulmonary arteries. But as you already know that the lungs of the baby are not functional, so this blood does not move to the lungs to be oxygenated. Instead, it is deflected into the aorta, bypassing the lungs and the left side of the heart and going directly into the aorta, so that it can be distributed to different parts of the body through the peripheral branches of the aorta. I hope you understand. So now as soon as the baby is born and he takes his first breath, this ductus arteriosus is closed off. So in some abnormal conditions, when this ductus arteriosus is not closed off and remains open, now there is an additional pathway between the aorta and the pulmonary artery. So how does this affect the blood pressure? The first effect it is going to have is a great reduction in the diastolic blood pressure. As you can see that in a normal person, the diastolic blood pressure is around 80, while in a person with patent ductus arteriosus, it falls to as low as 40 millimeter mercury. Now why is it so? If you remember, I told you that the diastolic blood pressure depends only upon the peripheral resistance of the vessels. During diastole, when the aortic valve is closed and the elastic recoil of the aorta is taking place, the blood is pumped towards the peripheral arteries, and the only factor which is going to determine the pressure in the aorta is the resistance of these arteries. But during patent ductus arteriosus, there is an additional pathway which is present for the blood to move towards, and instead of moving to the peripheral arteries, some of the blood starts moving into the ductus arteriosus, which results in a great reduction in the aortic pressure, in the diastolic aortic pressure, which is manifested here in this graph. And you can see that instead of 80, the diastolic blood pressure falls to 40 millimeter mercury, because the blood has found an additional pathway to divert to and moves into this pathway, resulting in reduced pressure in the aorta during diastole. Now, another change that you see here is that the systolic blood pressure of the person with patent ductus arteriosus is also higher as compared to a normal person. While a normal person has a systolic blood pressure of 120, the systolic blood pressure of a person with patent ductus arteriosus can be as high as 160 millimeter mercury. The reason for this is that the blood which was diverted into the pulmonary artery during diastole through the patent ductus arteriosus is now being pumped out of the ventricle into the aorta in the form of increased stroke volume, resulting in raised systolic blood pressure. So now what are the findings we are going to find in this person? The systolic blood pressure will be increased because there is now more blood which is being pumped out per beat, because blood was deflected during previous diastole and now is being pumped out in the next systole, resulting in increased stroke volume. The diastolic blood pressure falls because of an alternate pathway provided to the blood, so the overall pulse pressure increases. As the systolic blood pressure rises, diastolic blood pressure decreases and the pulse pressure increases. Now let's move on to another condition which is quite similar to the patent ductus arteriosus, and it is known as the aortic regurgitation. In aortic regurgitation, there is an incompetence of aortic valve, which means that the aortic valve fails to close properly during diastole. So what happens in this condition is that during the diastole, the blood, when the aorta recoils, the blood, instead of moving into the peripheral arteries, moves back into the ventricle through the open aortic valve, and this results in decreased diastolic pressure, just like the blood which moved into the patent ductus arteriosus and reduced the diastolic blood pressure. Similarly, in aortic regurgitation, the blood from the aorta during diastole moves through the improperly closed aortic valve into the ventricle, and the diastolic blood pressure decreases, and then this additional blood is pumped along with normal quantity of stroke volume, resulting in larger quantities of stroke volume during the systole, which results in greater systolic blood pressure. So what will be the findings here is that the systolic blood pressure will rise, the diastolic blood pressure will fall, and the pulse pressure will increase. So this is the aortic regurgitation. Another important finding you will see in the graph of aortic regurgitation is that there is no incisora as can be seen in a normal graph. The incisora is not formed because the aortic valve is not properly closed, and as I told you before, incisora is formed when the aortic valve closes and the blood from the aorta fails to move back into the ventricle. So these are some abnormal pressure pulse contours. I hope you understood. If you did not understand, please ask me any related questions and I'll be more than happy to answer.